How many people here have heard of LASIK eye surgery? Two. All right. How many people know what happens during LASIK eye surgery? Okay. So LASIK eye surgery is something that is often talked about and advertised a lot on TV and in the media, but many people only have a surface understanding of what the procedure actually is. And over 30 million people in the United States have had the procedure done since it was legalized in 1999, and that's almost 3% of the total United States population. That being said, I think it's important that people understand what it is since it's such a common procedure and a life-altering one. This speech is about how LASIK eye surgery is beneficial, how it is performed, and what people should expect when they have it done. To start with, what exactly is LASIK eye surgery? LASIK reshapes the cornea through refractive surgery to correct vision problems. And the cornea acts as a sort of lens that focuses light on the back of the eye, which is called the retina. So a small flap is created on the cornea by something called a femtosecond laser, which shoots light and vaporizes corneal flesh. And it's only on for about 1/4 of a second. And for reference, 1/4 of a second is the amount of time it takes light to travel one virus cell. So it's really short. And when it's done and around the eye, it burns like a circle around the cornea. A flap or a hinge is left on one side so it can be flipped up to get to the stroma underneath, which is then what's reshaped. So after the cornea is flipped up, the goal is to reshape the cornea to better focus light on the retina. And nearsighted people's light focuses too far in front of the retina. This is called myopia. So their cornea is usually flattened during LASIK to focus it further back. Farsighted people are the opposite, called hyperopia, which obviously the opposite would be to steepen the cornea to focus the light a little further forward, I guess you could say. After that's done, whether it was flattened or steepened, the corneal layer is laid back onto the eye as it was before surgery, and that should heal naturally. Now, a plus to LASIK is that the only medication or something like that, I guess you could say, is that anesthesia drops are the only thing that's required. Now, after that's done, I got all of that from a website, and the guy that typed its name was Vogler. And as a result of this LASIK surgery, many people are able to enjoy life again and are less dependent on seeing aids like glasses and contacts. There are many benefits in getting the LASIK procedure done, but there also are some downsides as well. Now, obviously, a obvious benefit is that vision is improved immediately after surgery. Over 95% of people return to 40/20 vision, and 85% of those 95 people return to 20/20 vision. And obviously, 20/20 vision is pretty good. You don't need glasses with 20/20 vision. And another plus side is that the results of LASIK is permanent, although your eyes, obviously they changed shape before, and that's why you needed LASIK. And so they might change again after the procedure. Now, that being said, there are some problems that could arise after the surgery, but most are temporary. Things like seeing glares or starbursts around light during nighttime is something that happens, but that usually clears up after about a few weeks. Dry eyes is another annoyance that could happen after LASIK because your tear glands have a temporary decrease in production, and this is a little longer. It could take almost 6 months to clear up. Astigmatism is something that patients can but rarely experience. It's when the laser removes corneal tissue unevenly, and this is more of a human error that's caused by going to kind of not shady I should say, but lesser LASIK centers. And surgical errors caused by inaccurate surgery, which are things like missing the refractive target, which patients could commonly happen, like I said earlier, when they go to not a very good LASIK place, something like a place that's cheap. However, this last point is almost always caused by the patient's expectations being wrong after surgery. Most people think that it's a perfect fix-all, and it's not what it's meant to be. It's something to decrease reliance on visual aids. That being said, LASIK's not for everybody, and when the wrong candidate undergoes surgery, results might not always be perfect or what that person expected. An example of a bad candidate would be somebody who's under 18 years old, or somebody who doesn't have a stable vision correction at that time. So if your vision correction keeps changing year to year as you go to your eye care professional, that means you're probably not a good candidate, because it'll continue to change after you get LASIK. A patient might also have unrealistic expectations about never wearing glasses again. Like I said, LASIK is just something to decrease your dependency on that. So people can get upset after LASIK when they're told that they still need glasses. Before undergoing LASIK eye surgery, you should always consult your eye care professional, because self-referrals to LASIK surgeons are almost always the cause of dissatisfied patients. And in conclusion, LASIK is something that many people have heard of, as it is advertised frequently in the TV, on the TV, and in the media. However, many people know it only as an eyesight corrective surgery, and don't actually know what happens during and after the surgery. The cornea is reshaped to fix refractive errors in the eye. There are many advantages to getting LASIK, but there are also a few disadvantages, like I said earlier. These are often temporary, but